the definition of healthy weight. How do we define a healthy level of body fat and a healthy body weight? Well, it's variable. We've really gotten away from terms like the ideal body weight because what is good for one person is not necessarily good for another person. And these things do vary by gender as well. So what actually is healthy weight? Well, there are many things that contribute to your health, and weight is just one. So being able to move comfortably is one thing, and looking at your risk for chronic diseases is another thing, because we know from our studies so far that excess body weight contributes to our risk for many chronic diseases like diabetes, cancer, heart disease, and other things as well, like arthritis. We have to think about what weight means in the context of overall health. If you can maintain a healthy weight within that prescribed range of BMI over time without stressing yourself out and always feeling like you're restricting your food intake, feeling deprived all the time, then that's fine. But if it's causing you massive distress in other areas of your life, maybe that is not a healthy weight for you. And healthy weight can really be a very confusing issue, but it's more complex than just saying, here's your number. So currently, when we're talking about measuring your weight for height standards and to kind of estimate body fat, we use body mass index to kind of indicate whether someone is overweight, obese, or underweight. But we also have to take into consideration other factors when determining whether a person is of healthy weight or versus an unhealthy body weight. And we can, in terms of calculating your BMI, if we're using that metric unit, basically we talk about taking your weight, dividing it by your height, in terms of meters squared. So for example, if you're 70 kilograms and you're about 1.6 meters, you divide that, you take 1.6 meters and square that, you're going to get 2.56 meters squared. And you take your 70, divide that by your 2.56, you're going to get 27.34. And basically, you fall into the category of pre-obese. And you see the table over there, and we want to interpret that in terms of weight status. This is the table that the current recommendations that are given by the World Health Organization. And it kind of shows us how we can interpret BMI. And a normal or body healthy mass index should be anywhere from about 18.5 to 24.9 kilograms per meter square. And that's where, and if we're talking about the results that we got just now, 27.34, you're going to fall into that pre-obese category. And if you're using the English unit, basically you just take your pounds, divide that by inches, and you square that inches, and times that by 703, because that is the conversion factor. So anybody who's below 18.5, they're considered to be underweight. 25 to 24, 29.9, they're considered to be overweight. 30 or more would be considered obese. But be sure to know how to calculate your BMI and how to interpret it. And the figure over here estimates body shapes at different BMI classification. And these pictures kind of show you approximately what the body shape would be of a person with a BMI of 20, 25, and 30. So the figure here lists all the health problems associated with excess body fat. The greater the degree of body fatness, the more likely and the more serious these problems generally become. And they are much more likely to appear in people who show an upper body fat distribution pattern and or are greater than twice their healthy body weight. Apart from all these diseases, what we notice over here, I did put the psychological burden, and it comes together with poor self-esteem, discrimination, and that really happens a lot. Like in Japan, they really emphasize body weight for women particularly, and sometimes they might turn you down for jobs if you're obese, and that also happens in places in Europe. And there's also that risk of eating disorders. And we can also look at some of the how overweight potentiates certain diseases in those genetically susceptible to. And what we know is that there are these 5 diseases all have a genetic component, and they play a very important role whether or not that genetic predisposition will be expressed. So if let's say you have a family history of high blood pressure, you will have a genetic predisposition of getting high blood pressure. And if your weight goes down, how will that influence that ability of your genes to actually express that genetic predisposition? So if you're unhealthy overweight, you're more likely to get that high blood pressure. Also, if let's say you have high blood pressure and you do lose some of the excess unhealthy weight, that can dramatically diminish the genetic expression of that high blood pressure. Also, after we talked about looking at BMI, but we talked about some of the other important factors that can help. And these are some of the important factors that can determine if a person's weight is in fact unhealthy. And we will go through each of this one by one. So there are a couple of ways to define obesity. Typically, we are looking at BMI, which is a super simple screening tool. So when BMI is higher than 30 kilograms per meter squared, we think that the person probably is obese. And obesity really means excess body fat. Just because a person has a high BMI, it doesn't necessarily mean they have excess body fat. A better way to know this is to measure body composition. And we need to consider what percent of your body is actually made out of fat. So this is where body composition assessments come in and examine what parts of the body is lean versus fat. And we can see this in the picture over there. They have similar body fat, but different body composition. And when we're looking at percent body fat and what's healthy, typically we would consider more than 25% of body fat for men and more than 35% body fat for women to be excess body fat or obese. So now we can look at other ways and we can talk about other ways to assess body composition and weight status. So as you can see over here, there are two different forms of obesity shown on the slide. We have your android obesity, and we also have your gynoid obesity, which is the woman over here. And body fat stored primarily in the upper body, android, brings that higher risk of obesity-related diseases than the lower body, gynoid obesity. Android means male and gynoid means female. But some women can have android obesity and some men can have gynoid obesity. These terms are not perfect, but the android obesity, where fat is kind of deposited in the midsection, that's the higher risk. Sometimes android obesity is also called the upper body obesity or the apple shape or central obesity. Or sometimes in your reading, you might see visceral obesity, and that's another term. But all those are the kinds that are not so healthy. We can also look in terms of waist circumference. More than 40 for men and more than 35 for women indicates increased risk of disease. And that weight in that midsection is related to chronic disease risk. So for example, your type 2 diabetes, coronary artery disease, which is another word for your heart disease, and hypertension are the biggest ones. And gynoid obesity is called the lower fat, and that's the pear shape, which you see in the woman in the picture, where fat is stored in the butt and in the thighs. It's just there for reproductive purposes and it doesn't tend to increase the risk for chronic disease. But after menopause, when women's estrogen levels start to decline, if they're gaining extra body fat, women are just as likely as men to gain that in that midsection. So estrogen is actually really that protective effect against android obesity. But after menopause, that all goes away. And there's nothing that we can do along with BMI. And so if you find somebody who has a BMI in that overweight obese range, we can also look at where that excess body fat is. And that easiest way to kind of do that is to measure waist circumference. And like I mentioned in the other slide, your waist circumference is super easy to do to kind of measure because it's usually around that umbilical area Or so you can use your bony markers like the lowest rib and the iliac crest, which is the top of your hip bone, and go midway between that, and that measurement can be used to assess the excess body fat or your body fat distribution. And we also have to consider your frame size. We've definitely heard of people who are big bone person or a small frame person. We do in fact come in different frame sizes, and that's kind of genetically determined. And our skeleton can either be larger or smaller. We can also talk about fitness, and this appears to be the strongest predictor of health risk more than any of the other measures. So this was a study that was done of over 25,000 men and women in the US. Each was tested for their fitness level and then also for their BMI, body composition, and waist circumference. All of this were kind of taken and measured. They were followed for more than 10 years to see who died of what and to determine what initial measure best predicted mortality. So if we kind of look at the graph, we see that on the far left, all the people who were measured lean and either by lower BMI or less body fat or smaller waist circumference. The middle group are the people that measured normal either by normal BMI, normal body fat, or normal waist circumference. Over to the right are all the people that measured obese by high BMI, high body fat, or large waist circumference. So within each of these weight groups, we see the yellow and pink bars, and these are the people further broken down by how they are tested for fitness level. The pink bars are those people who tested fit, and the yellow bars for those who are unfit. And the first thing that we can notice is that the yellow bars are taller, some twice as tall, and one even 5 times as tall as the pink bars. And we can talk the height of the bar, which is your y-axis, is your mortality rate during that 10-year follow-up. All across the categories of the fit people, which is your pink bars, of any weight, they had, on average, half the mortality rate than the unfit people. So for instance, a fit but obese person had less mortality risk than an unfit but lean or normal weight person. These results may have been seen in other studies as well. So fitness is a very important factor in terms of health and health risk. Many health professionals try to have people try not to fixate on the number on the weight scale, but rather focus on fitness and finding ways to simply be more active and to enjoy it. This table lists both the genetic nature and environmental nurture factors that increase the risk of obesity. So what causes excess body fat? We can think about the big two: eating too many calories and not burning enough calories. So those are the big two. Everyone wants to boil it down to those two very simple factors in the energy balance equation, which is your energy in and your energy out. So if we have more energy, our weight is going to go up. If we have more energy out, our weight is going to go down. And those are the big two. But in reality, there are hundreds of other factors that's going on into what's causing a person to gain weight. We have genetic predisposition, which means that a person who is obese, they're probably going to have children who are also obese. And if you're a child of a person who has two obese parents, your rate of having obesity is probably about 80%, and that could contribute to it. Just genetics, but definitely lifestyle is going to play a part. So there's a lot of things that is here that is out of our control, and there are some things we can control, and there's so many other things other than energy in and energy out, and you can go through this yourself. Similarly as well, we see in terms of medications, we are using a lot more pharmaceuticals, and a lot of those things have weight gain as a side effect. So you can go through this table yourself.